Lakasan ng pakiramdam, lawakan ng isipan. Hello everyone and welcome to the 15th Ako para sa Bata, I am for the Child Conference. I am Dr. Joanna Jabi Herrera, Chair of Ako para sa Bata Session 5, and I'm very happy to be your moderator for today. The Child Protection Network Foundation is celebrating the 15th year of the Ako para sa Bata Conference, a continuing education for individuals and professionals in the front line of child protection work. Ako para sa Bata 2023 with the theme Usapang Lusog Isip, Mental Health para sa Bata is presented by the Australian Aid, UNICEF, and the Child Protection Network Foundation. And again, I'm Dr. Jabi Herrera, and I am one with you in pledging Ako para sa Bata. On behalf of the Australian Aid, UNICEF, and the Child Protection Network Foundation, we are deeply grateful for your support. So, welcome to the Ako para sa Bata Session 5, Usaping Anxiety ng mga Kabataan or Understanding Anxiety in Children and Teens. So, even before the COVID-19 pandemic, growing numbers of young people were already experiencing high rates of clinical anxiety. However, during the pandemic, those numbers nearly doubled, such that 20.5% of youth worldwide now struggle with anxiety symptoms. We are beginning to see that anxiety disorders among children and teens can be serious. It can lead to self-injury, suicidality, substance abuse, and other mental health disorders. And yet, the proportion of young people who receive treatment for anxiety is the lowest of all major categories of mental health disorders. So this is a very important conversation. So this session aims to educate child and youth workers, our educators, healthcare providers, and caregivers on the importance of identifying and treating anxiety disorders. Our session will present the different ways that anxiety manifests among young people, their vulnerability and protective mechanisms that's related to anxiety, the key factors that make intervention for anxiety disorders effective, and how to support children and teens with practical tools and strategies for managing anxiety. So napakarami nating matututunan sa session na ito. So many children and teens suffer from anxiety disorders and can experience serious consequences from untreated anxiety. There are effective interventions for anxiety that can help young people get better and prevent negative outcomes, which we will share during this session. So our objectives here in this session are to develop awareness on the different types of anxiety and the manifestations of anxiety disorders among children and teens. We want to learn the neurobiological, cognitive, social-relational factors that affect the development of anxiety disorders. We want to become aware of the consequences of untreated anxiety disorders, become familiar with evidence-based interventions, and what makes for effective treatment of anxiety disorders, and apply practical tools and strategies that you can use to help children and teens manage anxiety at home and in school. Okay. So our program is flashed on screen. We have two very competent resource persons, both from We Thrive Consultancy and Wellbeing Services, which I'm also a part of. We are also a part of Circle of Hope Community Services, a nonprofit organization that provides mental health resources and services to underserved communities. We Thrive stands for our collective path to well-being, and Circle of Hope stands for hope through compassion and purpose. Later, we will also launch some psychoeducation videos, and we will entertain questions during the open forum. We will end the session with a self-care activity. Abangan po natin ito, our safe space visualization. So again, welcome to Ako Para sa Bata Session 5, Usaping Anxiety ng mga Kabataan, Understanding Anxiety in Children and Teens. We hope you take in as much knowledge as you can. Let us proceed with the first speaker. Our resource person is the co-head of clinical services and a clinical supervisor at We Thrive Consultancy and Wellbeing Services, Inc. She's a licensed psychologist specializing in clinical psychology, neuropsychology, in formal assessment, and trauma-informed psychotherapy. She is top 1 in psychologist's licensure exam in 2016. To present anxiety disorders in children and teens, let's all give a warm welcome to Ms. Cherry Ann Law, MA, MSc, RSci.
Good morning, everyone, and thank you for taking the time to attend this webinar. So my name is Cherry, and I'm the co-head for clinical services at We Thrive Wellbeing and Consultancy Services, Inc. So I actually work with Doc Jabi and with Malin, who will be presenting after me. So for this session, we'll be discussing anxiety disorders in children and teens. So what are the goals for this session? First, we'll have a brief overview of what anxiety is and its clinical manifestations. We'd also like to identify what are the risk and protective factors for individuals when it comes to having anxiety-related disorders. And what are also the challenges and how to identify red flags? And then what does it mean to have anxiety? What might be the long-term outcomes if these are not addressed? So what does anxiety look like? So just a brief background. In the Philippines, 10 to 15% of Filipino children from 5 to 15 were reported to have mental health issues, while 16.8% of 13 to 17-year-old Filipino students have had at least one suicide attempt. So this survey was taken in 2021. So I do think that this has increased over the years, and these may be underestimations, as there are also a lot of unreported cases. So you see how, anxiety is prevalent in any culture. So what does anxiety look like? It could manifest in the way we feel. So it's feelings of dread, fear, uneasiness, or it could come up in the way the way our body feels. So you could feel like literal tension, and also the way we think. So worrying. Anxiety has a function. No? It can will us to action, and it also tells us when something is maybe dangerous or something is that, or we have to prepare for something. But when it becomes persistent and there's already irrational fears that's surrounding the feeling, then it has to be checked. No, when there's no longer a context to feeling worried, then that's something that has to be something that we have to be curious about. And then an anxious predisposition can develop over time, no, because of changing developmental needs. So as we age, the context that we are in and the things that we have to do for ourselves for our development also changes. And if we don't get the support from that, or we're unable to cope, then the anxiety will build up. So here, we'll look into the neurobiology of anxiety. So usually when we say anxiety, people would always say, oh, it's just psychological, it's mental, so you can cope with it by changing your mindset or changing your attitude about it. But actually, studies have shown that the psychological is also biological. Also, when it comes to anxiety, it causes an imbalance in the brain, in the chemicals in our brain, which are, the more scientific term, these are the neuropeptides and the neurotransmitters. They are responsible for regulating stress and other activities that might help with alleviating stress. So for example, serotonin, this is for mood, sleep, or appetite, norepinephrine, alertness and attention, and for GABA, slows down signals. Okay, so because there's a biological basis to it, it's important that we also look into how medical interventions can help with treating anxiety. I know that there's still a stigma around it. especially when it comes to giving medication to our children, right? I mean, as adults, we're concerned about that. But, if there's a biological basis to it, then part of the intervention also has to be biological. In the same way that we deal with biological diseases, no? Um, so that's the part on the brain chemical. So now we look into how the brain is organized and then what anxiety looks like in these parts of the brain. So to simplistically organize the brain, there are three parts. No, there's the reptilian brain, there's the feeling brain, and you have the thinking brain. So the reptilian brain represents our the part of the brain that launches us into survival mode. No? So when something is a threat or we feel unsafe, um, it kind of activates the fight, flight, or freeze response in us. So simple example, when something is hot, you let go of it. So that's a flight response. Now, so you don't think twice, your body acts on your behalf. The feeling brain naman, it has the amygdala, the limbic brain, or the emotional brain. So this is the part of the brain that is mostly activated when we are feeling anxious. No? And they found that when there's anxiety, there's higher activation in this part of the brain. And when this part of the brain is activated, then it kind of affects the way we think. So the higher order thinking processes. So that's in the thinking part of the brain. So that's associated with the way we pay attention, the way we organize our behavior, plan our behavior, or for example, time management. So usually when the body feels like it's in survival mode, it actually affects the way the limbic brain is functioning. So sometimes, even if you don't have anxious thoughts, nagde-develop siya over time. Kasi, we're not aware that our reptilian brain or the survival mode part of ourselves is being activated without our knowledge, and then it builds up to the feeling brain. So as I mentioned earlier, anxiety can look like tension in the body. So even if we don't have anxious thoughts, but our body feels like it's under stress, no, it can send a message to the feeling brain to increase the activation, right? And then the anxiety will build up. So sometimes, di ba, people will say na, I wasn't thinking of anything naman, pero biglang at some point, I just started feeling anxious, no? And it's affecting the way I think. I'm now, thinking of all the worst case scenarios. So that could be, related to the reptilian brain. So that's why in anxiety, which I think Malin will discuss, it's very important to not only address the thoughts and the emotions, but also the way our body is feeling. So if you notice when your body is more relaxed, you're less prone to becoming anxious. No, so what this model is also saying na it's important to regulate the feeling and the survival brain or the reptilian brain for the thinking brain to work properly. So that's the feeling of anxiety. What are the clinical manifestations of anxiety? So we have the DSM-5, which is the Diagnostic Statistician's Manual. No, it's our Bible. No, for psychiatrists and psychologists in identifying different kinds of mental health disorders. So these are things that you might encounter. This is something that we usually encounter in our clinical practice. So you have generalized anxiety disorder. So just worrying about everything. Separation anxiety, usually you see this in kids. For example, they start going to school and they feel really distressed when they're separated from their parents. So it's not the normal na parang, di ba, for the first few weeks that really happens, but this is the case for kids na parang it's very long-standing, no? And it's not just about going to school. When the parents go out, they still feel this intense anxiety. Intense anxiety when they're away from their parents. You have phobias, which we're particular with. We're panic disorder attacks, social anxiety naman. Having thoughts that we will be evaluated negatively in social situations. Selective mutism. So children with no language problems, but they choose not to talk in certain situations. And agoraphobia. So this is the fear of being in open spaces. Thinking that there's difficulty with escaping a situation. So what's the, even if, someone's anxiety doesn't qualify in these clinical manifestations, if it's already causing significant impairment or distress, your everyday functioning is affected by your anxiety, it still has to be addressed even if there's no name for it. What are the long-term outcomes if anxiety isn't addressed? So it can make children and teens become more avoidant. So as I've said, no, it activates also the reptilian brain. If anxiety, something makes you feel anxious, you do a flight response. No, you get away from the thing that's making you feel uncomfortable. But because of this, they can miss out on learning and formative opportunities, giving them less opportunities to fulfill the developmental tasks that they're required to, or parang that would be considered mentally healthy, no, at that age. For example, when it comes to finding yourself, your identity, it would be difficult to do that if you don't interact with others, or if you don't engage yourself in different activities. Other long-term outcomes, it can lead to other kinds of mental health. So substance use and eating disorders and self-harm. No, so that's just a mental health level. Other outcomes, there are biological and social outcomes that are associated with it. Poor physical health, no, more difficulties in family functioning. When you start raising your own kids, you can be more anxious as well. And then the educational attainment. In terms of economics naman, poor mental health has cost the world economy $2.5 to $3 trillion a year in 2010. And it's predicted to increase. Right? So there are economic implications when it comes to addressing mental health. And part of that is addressing anxiety. So who are at risk? So kids who or individuals who grew up in a negative family environment. So a lot of conflict, no, and academic failures. No, so the way kids perform in school, it really affects their self-esteem and can cause anxiety. There's also genetic risk. No, 30 to 50%. If your parents are anxious, you have anxious. It runs in the family. Then you're more likely to inherit it. But they're also saying that is it more of nature or nurture, meaning if you have a parent who's anxious, then their parenting practices could also make the child anxious, will also teach you anxious behaviors. For example, oh, you can't go there, you can't go here because this is what will happen. So you start teaching that to the child, they start developing anxious thoughts as they grow older. Sex differences also plays a factor. So it seems that females are more at risk, but we have to take in other factors when it comes to this finding. It may not be just biological. No, there are societal expectations from females that may produce more anxiety, or there's also societal expectations for men to not express the way they feel. No, but we have to note that this study was done in 2005, right? Now we have to recognize that there's a whole spectrum when it comes to gender identity. And when it comes to the LGBTQ plus community, they're also more at risk when it comes to developing mental health problems, no, because of the challenges that come with it. It's also greater for those in lower income households. So when your biological physical needs are not met, of course, you're constantly in an unsafe you feel unsafe. So that causes anxiety. No, people have poor social skills because it's important to make connections that helps with lessening anxiety. Shyness, so introversion, not necessarily introversion, but difficulty with, so related siya to poor social skills and the presence of another disorder. What are the common sources of stress? For children, it's more external. So monsters or the dark or school, right? For teenagers, it's more internal. So it could relate to their performance, how other people perceive them, physical changes, and global issues. No? So there's an influx of information while kids have become more involved, right? That's very good. No, they're more involved and engaged. It can also cause anxiety. So as adults, we have to support our kids in these in the situation now, right? It's not a realistic intervention to just have kids not engage in social media, because that's not the world now. So all we can do is to support them. No, so it's very internal. And what are the common challenges in detecting anxiety? Sometimes you can discount these feelings because of age. Parang bata-bata mo pa, dami mo nang iniisip, no? Not recognizing that they have their own inner world. They have their own internal experiences, and we shouldn't invalidate that. And then the shoulds, whenever sometimes when kids express their anxiety, no? Sometimes you would respond, dapat magpasalamat ka, nung panahon ko nga, ganito, ganyan, right? So, again, it's very invalidating. Or sometimes attributing anxiety to personal traits. So, if someone is very withdrawn, we can just say na, mahiyain talaga siya, or she's too sensitive, no? And then we don't kind of take the time to understand that maybe something else is causing the anxiety. And also, we might also be dealing with our own anxiety. So self-care is also very important. So you are more effective in providing support to others. No, and children and teens still find it difficult to express themselves, right? So they're still developing that language, no, getting to know themselves. So we have to be very patient with that. And for parents, of course, there's a tendency to correct rather than explore what's going on, which is perfectly understandable, di ba? Kasi we want the best for our kids. Who doesn't want the best for their kids, right? So, but sometimes we do this out of anxiety. So what are the common signs of anxiety in kids and teens? No? So the general rule is if you notice any significant change in behaviors, that is a warning sign. So when you notice these behaviors, it's important to be curious rather than judge what's going on. No? Especially when it comes to school productivity. So I'll tell you why in a minute. Because children with anxiety may be restless, fidgety, express negative thoughts, struggling with concentration, and that affects school productivity. No? So here is more of a exhaustive list. So physically, as I mentioned, no, parang all parts of the brain, they're involved when you're feeling anxious. We can have headaches, neck aches, stomach aches. You know, sometimes you have kids na parang when you have them checked at the doctor, there's nothing wrong, but it could be anxiety, no, bedwetting, that could still happen. Emotionally, there could be anger. So for kids, sometimes the sadness isn't really expressed, but it can be expressed as irritability, loneliness, sadness, sensitivity, or needing a lot of reassurance. Cognitively, it could be irrational fears, difficulty with concentrating. So it affects schoolwork, no? Sometimes that's the first, usually parents only notice the anxiety when the child is already failing, and that's when they bring the kids to us, no? But there are, it's part of the sign, no? And then behavioral, there could be use addictive behaviors, no, to help regulate themselves, or there's withdrawal or avoidance, restlessness and having nightmares, or they start to withdraw from others. So, those are behaviors that we can try, but there are also free screening tools if this is something that we, it's part of our job. Flagging for anxiety is important. There are also screening tools. These are free. You can find this online. So you have DAS, Anxiety Test by Mental Health America, PHQ, and online assessment measurements by DSM-5-TR. Also, if parang this is part of your work, this is one way that you can screen anxiety in children. Unfortunately, there are no Filipino or in our local languages. There is no version of it, but maybe you can use it informally, translate it, and just do it as part of an informal interview. So we discussed risk factors and the signs of anxiety. So now we're looking into the protective factors. Now, what are the things? Because anxiety is a part of life. It's something that we cannot avoid. No, and it's something that we cannot protect our children for the rest of our lives. They have to learn how to cope with it. And what are the things that can help them? First, family relationships. So, a risk factor was negative family relationships, but a protective factor is positive family relationships. So, the caregiver could be a source of positive feelings that can help counteract anxious feelings. No? And when an individual feels safe in their environment, not just physically safe, but psychologically safe, it calms down the body. good peer support. So the same, it's relationship. So both of these, they foster a sense of belonging in the child. Academic achievement, this helps with self-esteem. No, so we support them academically. That's important, but no pressure on on achieve being the best student, right? So it's just enough so that they feel like they're good at something. It's not necessarily have to be academic achievement, but it could also be extracurricular activities. And then learning emotion regulation skills. So this is very important. I think this is what we as in our education system, this is something that we fail to recognize. So it should be writing, reading, arithmetic, and regulation. So it should be those 4 R's that we're developing. And also, when it comes to relationships, it's one way to also address anxiety is not just by talking, but having experiences where the child feels that they're in sync. So very simple, dancing with your kids, playing with your kids, singing with your kids. That helps them create rhythm in their body, rhythm in their brains, and rhythm helps with alleviating anxiety. Okay, so yeah, that's the end of my presentation, and hopefully you learned something new about anxiety. And um, yeah, I hope you enjoy the rest of these sessions, and I think we'll have a Q&A now if there are additional questions. So thank you, everyone.
Thank you very much, Sherry, for that very informative presentation. Anxiety is a mind-body experience. It's not just in the mind; it also lives in the body. We learned so much from Sherry, and we will welcome your questions later during the open forum. And next up, sa ating usaping anxiety, we have our next presenter. She is a co-founder and a clinical supervisor at We Thrive Consultancy and Wellbeing Services, Inc. She's another licensed psychologist specializing in psychotherapy, intensively trained in dialectical behavior therapy, or DBT, to present effective treatments and practical strategies for addressing anxiety in children and teens. Let us all welcome Ms. Maria Lynn or Malin Domingo, MAR. Welcome, Malin.
Hello, everyone. It's a pleasure to be here with you today. I'm here to talk about interventions for anxiety disorders. But first, I'd like to thank Doc Chabi and the Child Protection Network for inviting me to be part of the Ako Para sa Bata conference this year. For our learning session today, these are our goals. I'll talk about evidence-based interventions for anxiety disorders, the key mechanisms in the treatment of these disorders, and practical tools and strategies for effective management of anxiety. Anxiety disorders are the most common mental illness affecting the youth globally. And as mentioned in the previous session, those who suffer from this condition are at higher risk to perform poorly in school, to miss out on important social experiences, and also to engage in substance abuse. So, left untreated, the disorder can become chronic and constant and may persist into adulthood. In addition, children and teens with anxiety disorders are at risk for developing later in life other anxiety disorders, depression, and substance dependence. And so these negative consequences linked with anxiety disorders highlight the need for early and effective assessment and intervention. Anxiety disorders are treatable, and the vast majority of people suffering from anxiety can be helped with professional care. Now, the most common treatments for this condition are psychological therapy or psychotherapy and pharmacotherapy. Complementary or what we call adjunct interventions can be helpful as well. and can be integrated into the child's overall treatment plan. Examples of these are yoga, breathing techniques, and meditation. Now, for children with severe anxiety, experts recommend a combination of psychotherapy and medication. Today, I'll focus on psychotherapy, and there are a number of treatment modalities that psychologists and therapists use to address anxiety, such as cognitive behavioral therapy, acceptance and commitment therapy, psychodynamic therapy. There's also a new intervention called attention bias modification treatment. Um, but for this session, I'll delve into the intervention that have been studied extensively and proved effective in treating anxiety in children and teens. And this is cognitive behavioral therapy, or CBT for short. CBT has two components, cognitive and behavioral, as the name suggests. The cognitive component helps young clients understand how their thoughts contribute to their anxiety symptoms. So by learning to change those thought patterns, they can reduce the likelihood and intensity of the anxiety symptoms. With the behavioral component, patients learn techniques to reduce the behaviors linked with anxiety disorders. And this is done through exposure. So clients are encouraged to approach activities and situations that cause them anxiety, such as socializing with peers or going to school or being in an enclosed space. This is done so they learn that their feared outcomes, what they're scared of, such as being rejected by everyone in school or dying when in an enclosed area, are unlikely to happen. Now, of course, when it comes to any kind of intervention, it's important to choose an approach that's developmentally appropriate. And so the intervention for a 6-year-old kid will look different from the one for a teenager. For young children, cognitive behavioral play therapy has been found effective. CBPT combines cognitive therapy with play therapy. And this is useful for young children who may not have the ability yet to generate insights or may not have the capacity to use sophisticated language. And therefore, play activities are used to represent what they're experiencing and also what they need to learn. Unlike play therapy that is more free-flowing and child-directed, CBPT provides structured, goal-directed activities, while of course still allowing the child to bring spontaneous material to the session. And with CBPT, modeling is used to demonstrate adaptive coping skills to the child. So toys serve as the means to demonstrate the behavior that the therapist wants the child to learn. So for reference, you may check the book by Susan M. Nell, who developed this treatment modality. For older children, Coping Cat is a CBT-based manualized program specifically developed to treat childhood anxiety. It consists of 16 sessions, but there's an abridged version with 8 sessions. So the program has a therapist's manual that guides the treatment and a corresponding workbook for the child. The workbook is in English, although it's been translated to different languages. I'm just not sure if there's a Filipino version. But the workbook has illustrations that are easy to grasp, even for non-English speaking children. So the treatment protocol includes first, psychoeducation that teaches children how to identify cues for anxiety and teaches them skills to help them cope, such as relaxation, cognitive restructuring, and problem solving. The second part of the protocol is engaging children in exposure tasks. For teens, there are two interventions that can help in treating anxiety disorders, and this is the CAT project, which is the teen version of the coping cat, and dialectical behavior therapy. DBT is considered part of the third wave of CBT. And DBT for teens includes one-on-one sessions with a therapist and group skills training. So DBT teaches youth different skills, such as mindfulness, emotion regulation skills, distress tolerance skills, and interpersonal effectiveness skills. And these skills are meant to help them engage in effective behaviors and manage their emotions better. When helping young individuals cope with anxiety disorders, we can't really separate them from their family system. Parental involvement is key. This may include family therapy and psychoeducation to help parents and family members understand the child's anxiety, and also to teach them how not to reinforce anxious habits. Sometimes parents may unwittingly foster the child's anxiety by providing too much reassurance or protection, or they may do the opposite and invalidate and ignore the child's anxiety. And a lot of times, the parents themselves need support. So, parents and caregivers can also learn to manage their own emotions and behaviors, particularly how they relate with their children. So, they can be supportive instead of being overly protective or accommodating, or on the other end, invalidating. We know that anxiety manifests in different ways. It influences the body. So when we're anxious, we may experience muscle tension, heart palpitations, sweating, difficulty sleeping. It influences the behavior such as avoidance, escape, addiction, and it influences the mind, like having cognitive distortions. Most anxiety interventions target these three interrelated symptoms. And generally, these interventions entail rewiring the brain. From the neuroscientific perspective, there are two pathways to anxiety: the amygdala pathway and the cortex pathway. The amygdala is the main processing center of emotions in the brain, while the cortex is the thinking brain. And both parts of the brain can give rise to anxiety. In most cases, people experience anxiety through both pathways. And the amygdala pathway activates both the physical and behavioral symptoms. It influences the nervous system, particularly the fight-flight-freeze response. And so when the amygdala senses danger, in whatever form, it can be the danger of getting humiliated in front of people, it sends signals to the nervous system, which in turn mobilizes energy within the body. And so the person may have difficulty breathing, rapid heartbeat, to prepare to defend itself against danger in the form of behaviors such as the flight response, like avoidance, which is common among people with anxiety. Now, the cortex pathway ignites the anxiety through thoughts and images. For example, the constant thought of failing the math exam. I will fail the math exam. I will fail the math exam. And that will activate the amygdala, which will then produce anxiety. So as you can see, in both pathways to anxiety, the amygdala plays a role. So Managing the amygdala is essential for treating anxiety. To manage the physical symptoms of anxiety, a bottom-up approach will help, meaning calming the anxiety through the body. So using the body to send signals to the amygdala that right this moment, it's safe. Relaxation, such as deep breathing, regular exercise, especially yoga, and sleep have been found very helpful in deactivating the amygdala. And these strategies can have immediate to short-term effects. Now, you might ask, why only short-term effects? Well, if someone with anxiety stops these interventions, stops exercising, or stops uh, doing relaxation activities, or starts having problem with sleep, there's likelihood the amygdala might again incite the anxiety. So to extend the effects of these interventions, it's very important to be intentional about doing them constantly and regularly. Make it a habit to engage in such activities to make the effects longer lasting. Now, exposure is the behavioral intervention that experts see as having lasting change because it helps rewire the amygdala. The amygdala is not logical, it's not rational, it's located below the thinking brain. And it learns through association, through experience. And so if it associates a dog to danger because of a very, let's say, uh, very bad past experience with a dog, then the sight or sound of a dog will activate the amygdala, even though it doesn't seem rational to be scared of a cute dog, for example. So exposure helps the amygdala learn through experience that what it's scared of isn't as scary as it perceives it to be. Managing the cortex, the thinking part of the brain, can help calm the amygdala. So this is the top-down approach, using the capacity to think to dial down the anxiety. Successful interventions usually incorporate both bottom-up and top-down strategies. Some of the ways to calm the amygdala through the cortex are: one, mindfulness. It's training the brain to pay attention to the present moment without judgment and just being curious about what's here. Um, Anxiety often activates forward thinking and worrying about what could go wrong in the future. Mindfulness is a skill that can help kids to pull their thoughts away from their worries and back to the present moment. Checking the facts is a technique to help the child examine their thoughts and interpretations to see if they're real or not. Like a child might think, I fail at everything. So helping him see that it isn't true, that there were things he actually did well or he succeeded in doing. And that will give some proof to the cortex and the amygdala that their thought or interpretation isn't true. And then there's worry time schedule. It's a CBT strategy of setting a time for worrying. Worries can be all consuming and it can affect one's focus. A worry can pop up anytime. Instead of engaging with the worry every time it comes up, teach the child to set a regular time for it. So being aware when a worry pops up and then setting it aside for later. For example, 30 minutes of worry time every 6 p.m. before eating dinner. When the 30 minutes is up, then shift to the next activity. And then coping thoughts, helping kids to come up with statements that will help them calm down. Example saying, this too shall pass. Or, binibisita ako ngayon ni anxiety, pero uuwi din to mamaya. Aalis din siya. And for practical tools and strategies for anxiety, these are examples of relaxation techniques that you can teach children or teens who are anxious. Diaphragmatic breathing, which activates the parasympathetic nervous system, the rest and digest system. Often when we are anxious, our breathing becomes shallow. It's high in our chest, and we forget to breathe deeply into our abdomens. So abdominal or diaphragmatic breathing is very calming. It helps us draw oxygen deep into our lungs. And then there's progressive muscle relaxation, which is done by tensing different muscle groups. So noticing the sensation of tension, tensing, let's say, the hands, and then relaxing by letting go of the tension. And the goal is to increase awareness of both tension and relaxation and see the difference between the two. And remember, muscle tension usually accompanies the feeling of anxiety. And then there are simple mindfulness exercises that children can learn, such as mindfulness of the senses and mindfulness of emotions. Our senses are powerful tools to deal with feelings of panic, anxiety, and stress. So doing exercises with them, like the 5, 4, 3, 2, 1 exercise, you might already know that one. Asking them to notice 5 things they see, 4 things they hear, 3 things they feel on their skin, 2 things they smell, and 1 thing they taste inside their mouth. So that simple exercise can help bring their attention back to the present moment and away from their anxious thoughts. And here are a few examples of practical tools for managing anxiety. You may want to check them out later. Now, for the parents and caregivers of the anxious children you're helping, here are a few tips that you may share with them. First, exploring the feeling together, asking the child to observe his or her feelings of anxiety and then talk about it. What is happening when they feel anxious? How do they feel in their bodies? How long does the feeling last? So having an adult to co-regulate with them will help them feel safe and will make it easier for them to face their anxiety. The next one is shifting the focus. Oftentimes, anxious children become preoccupied and bothered by their anxiety, and they may have a sense that they're not in control of their thoughts and feelings. So helping them shift their focus on things they enjoy or encouraging them to do things they excel in will help them feel empowered and in control and to focus on the present. Next is healthy habits. Help children sleep and eat well. The same with the parents, for them to also adopt these healthy habits. And experts recommend 9 to 12 hours of sleep a night for 6 to 12-year-olds. And then teens need 8 to 10 hours a night. Same with adults. To protect sleep time, limit screen time at night and avoid keeping digital devices in the bedroom. And then help them use their senses, teach them how to use their senses. So again, mindfulness of the senses, like the 5, 4, 3, 2, 1 exercise, and then practicing belly breathing together. So when you model to them how to use these interventions, these strategies, they'll be able to pick up the habit faster. And so these are our key takeaways from this learning session. One, anxiety disorder can be treated, and early intervention is crucial. And then most anxiety interventions entail rewiring the brain to address physical, cognitive, and behavioral symptoms. And practical tools to manage anxiety include relaxation techniques and mindfulness practices. Allow me to end with this quote. Helping children and teens manage their anxiety can make a huge difference in their lives. And the other thing I want to highlight is that the coping skills, the emotion regulation skills they will learn from these interventions, they'll be able to use them throughout their lifetime. And that will help build their resilience and emotional competence. And these are my references. Thank you for listening. I hope you learned something from our session today. Thank you very much.
Thank you so much, Malin, for that very rich, informative discussion. We learned so much about practical strategies. We learned that when we address anxiety, we are helping children rewire their anxious brain to become more resilient. And that doesn't only happen through formal intervention or professional intervention, but through the daily habits and the support that we give to our children and teens every day. All of that makes a difference in rewiring the anxious brain. And right now, I know our discussions have already been very rich and informative, but we still have another offering for you. We are actually launching a psychoeducational video series. This is a series of educational videos on mental health and well-being, co-produced by Circle of Hope Community Services, Pinas Forward Academy, our PGH, Philippine General Hospital Adolescent Medicine Unit, with funding support from Mu Sigma Phi Sorority. This is a collaboration to offer more psychoeducational resources on mental health and well-being in the Filipino context. So let's please share for the very first time in public our psychoeducation video.
Maligayang pagbabalik. Kamusta ang tulog, tanghalian, araw at hapon? Halika na, tuloy tayo. Sa nakaraang episode, tinalakay natin ang epekto ng stress sa ating physical, emotional at relational health. Natutunan natin na ang light to moderate stress ay mayroon ding maaaring positibong epekto sa ating pag-iisip at mga gawain, habang ang matindi at patuloy na stress naman ay may dalang negatibong epekto sa ating kalagayan. Kasama na rito ang paghina ng ating immune system na maaaring maging sanhi ng iba't ibang sakit, ang epekto sa ating memorya, atensyon at iba pa. At pati na rin ang pagsubok na dala nito sa ating kakayahang pangalagaan ang ating mga relasyon. Pinuntahan din natin ang kwento ni Carlo at ang kaibigan niyang si Carla, kung papaano pwedeng harapin ni Carlo ang nararanasan niyang stress at kung papaano maaari siyang tulungan at suportahan ni Carla sa panahong ito. Ngayon naman, tatalakayin natin ang pagiging sensitibo sa stress o tinatawag na stress sensitivity at ang pagiging matatag sa stress o stress resilience.
Ang stress sensitivity ay kakayahan nating matanaw at mainda ang stress. Ayon sa mga iba't ibang pagsusuri, napag-alaman na ang tuloy-tuloy na pagdanas ng matinding stress ay nagpapalaki ng ating amygdala o tinatawag na fear center, habang pinaliliit naman nito ang hippocampus o ang bahagi ng utak natin na responsable sa memorya at abilidad nating matuto. Ayon sa pag-aaral, ang mga taong may mood disorders tulad ng depression at anxiety ay nakikitaan ng paglaki ng amygdala at pagliit naman ng hippocampus. Ayon sa pag-aaral, ang stress resilience ay ang abilidad ng tao na iproseso ang isang karanasan, lalo na ang isang stressful na karanasan, at makahanap ng panibagong perspektibo na nagbabalik ng lakas ng kontrol sa isang individual upang harapin ang pagsubok na ito. Kumbaga, kung hindi maaagapan, ang pagpatuloy na paglago ng ating stress sensitivity ay nakakapagpabago ng mismong hugis ng ating utak, na siyang nagre-resulta sa ating karupukan sa stress o stress vulnerability.
Ano ang ibig sabihin nito? Puntahan natin ulit ang kaibigan nating si Carlo. Sa normal na pang-araw-araw na buhay, maaari nating sabihin na si Carlo ay isang matatag at matipunong individual. Kaya niya siguro kargahin ang 1 kilong sako ng bigas. Marahil, kaya niya itong kargahin ng mahigit 10 metro bago sumakit ang kanyang mga braso't kailangan niya itong ibaba muna. Ngayon, isang araw, pinakiusapan ni Carla si Carlo na bumili ng 2 sako ng bigas at kailangan niya itong ihatid ng mahigit 3 kilometro ang layo. At dahil nagmamadali si Carla, halos wala siyang panahon para ibaba ito paminsan-minsan at magpahinga. Ano kaya ang mangyayari sa ating kaibigan? Marahil sa pagpupumilit niyang kayanin ang pakiusap ni Carla? Naku, bakit kaya? Baka masobrahan ng katawan ni Carlo at siya'y mapinsala. At ngayon, kahit isang maliit na bag ng bigas ay hirap na si Carlo na kargahin. Marahil ganito rin ang nangyayari sa mga taong nakararanas ng matindi at walang tigil na stress. Ang dating maliit na bagay ay nagiging malaki at ang dating madali ay nagiging mahirap. Ito ang gusto nating iwasan. Samantala, ang gusto nating makamit ay ang tinatawag na stress resilience o ang pagkatatag sa stress. Halimbawa, sa kaso ni Carlo, maaari niyang isipin,
Naku! Kapag hindi ko nagawa to para kay Carla, baka magalit siya sa akin at sabihin niyang hindi na niya ako kaibiganin at may iwan ako mag-isa.
pero kung may stress resilience si Carlo, maaari niyang sunod na isipin,
Teka, parang hindi naman ganung tao si Carla. Maunawain naman siya at may malasakit. Baka pwede kong sabihin na hirap akong kargahin tong mag-isa at alam ko na, hihingi din ako ng tulong sa kuya niya. Pwede naming pagtulungan para mas madali naming maihatid to kay Carla.
ito ang gusto nating mangyari. Kung ang stress ay bahagi nga ng ating buhay, gusto nating palakasin ang ating stress resilience at mapalayo tayo sa stress vulnerability.
Ito ay ilang halimbawa na pwede nating gawin para magpakatatag sa stress. Magkaroon ng routine o pang-araw-araw na gawain, limitahan ang pagbabad sa social media, regular na pag-ehersisyo, huwag mag-alinlangan humingi ng tulong sa iba, sapat na tulog sa tamang oras. Ilan lamang ito sa pwede nating gawin upang tayo magka-stress resilient. Ikaw, anong ginagawa mo upang magpakatatag laban sa stress?
Nako, marami tayong natalakay sa episode na ito at siguradong mas marami pang pwedeng malaman tungkol dito. Pero tignan natin yung mga natutunan natin ngayon.
Una, pinag-usapan natin kung ano ang stress sensitivity na siyang kakayahan ng taong mabatid at indahin ang stress. Natutunan din natin na tunay na masama sa ating kalusugan ang matindi at patuloy na stress. Binabago nito ang hugis ng ating utak at pinahihina nito ang kakayahan nating harapin ang mga pagsubok sa buhay o kung tawagin ay stress vulnerability. Sunod, natutunan natin ang stress resilience at ang mga paraan kung papaano patatagin ang ating sarili upang mas maging handa tayo sa karanasan ng mga stress. Natutunan din natin na ang stress resilience ay ang abilidad ng tao na iproseso ang isang stressful na karanasan at makahanap ng panibagong perspektibo na nagbabalik ng lakas at kontrol sa individual upang harapin ang pagsubok na ito.
Ngayon, ilang katanungan para sa inyo. Kumusta ka ngayon? Mataas ba ang iyong stress resilience? O mas bumabaling ka sa stress vulnerability? Pangalawa, kapag may mga pagsubok, ano ang mga normal mong reaksyon? Nakahanap ka ba ng mga mas positibong perspektibo upang harapin ito? O hirap kang makita ito? Pangatlo, ano-ano ang iyong ginagawa o maaaring gawin upang patatagin ang iyong sarili sa stress? Paano mo pwedeng tulungan sarili mo sa mga panahon ng pagsubok? Pwede niyong i-pause muli ang video ng sandali. Bigyan natin ng oras para maramdaman natin ang nararamdaman natin.
Ilagay ang mga kasagutan sa comment section ng video na ito o isend sa amin dito. Sana'y nag-enjoy kayo sa ating talakayan sa araw na ito at kita-kita tayo ulit sa susunod na usapin. Paalam!
Thank you so much. We hope that you enjoyed and learned a lot from that psychoeducation video. We have a lot more of these videos coming up. So please follow us on Facebook at Circle of Hope CS. Again, that's Facebook page at Circle of Hope CS for the launching of the videos. It's a whole series of modules and psychoeducation videos that are really very informative. So we also want to invite you to check out this book we call that's entitled Thrive. And that's a book that's been authored by our presenters here, by Cherry, Malin, and myself. It's a book about resilient parenting, so please check it out. And for those who are interested in low-fee psychotherapy, Circle of Hope has Kaloob. It's a low-fee psychotherapy service for underserved communities. Again, you can find us on at Circle of Hope CS in Facebook. So right now, salamat po sa mga positive comments on our psychoeducation video. We really appreciate it. So may I call back to the Zoom room our resource persons, Ms. Cherry Ann Law and Ms. Malin Domingo. And if we could entertain some questions by our viewers. I wanted to maybe address the first question. I don't know, Cherry or Malin, either one of you can respond to this. Someone from Barangay Molino is asking, why do anxiety disorders happen to children? Yeah. Cherry,
Well,
go
yeah.
ahead.
So, based on on my presentation, no, parang nakalagay doon may mga risk factors. So there are things that make us prone to anxiety. And at the same time, it is a normal emotion, right? It's sometimes, meron tayo, sa psych, no, or sa medical setting, may tendency tayo to over-pathologize things. Meaning, pag anxious ka, there's something wrong. We have to do something about it. But we also say na baka naman yung anxiety dun sa sitwasyon na yun ay warranted naman. Parang it's expected for someone to feel anxious in that situation, no? So parang we have this saying that me personally, I keep this in mind na there are normal reactions to abnormal situations. Right? So so anxiety happens kasi it's a normal part of life, no? But if it escalates or it becomes more than the usual, as we've discussed, no, dun sa ating first presentation, it's because may mga risk factors. There are other things contributing kasi yung bata naman, he's not developing na in a vacuum, 'di ba? Madami pang ibang nangyayari sa environment niya at may mga if you call it para ingredients in the recipe, there are certain combinations of these ingredients that can result in debilitating anxiety.
Yeah.
Thank you so much. Yeah, go ahead, Malin.
I was about to just highlight what Cherry said. Anxiety has a function in our lives. So, yung anxiety can give a signal na something is going on, something wrong that we need to attend to. And so, importante na makita natin kung disorder ba siya or normal anxiety siya. Because again, anxiety can be helpful to us and also to children.
Thank you. Thank you. So anxiety is normal, but when it becomes a pattern, depending on the risk factors, no, it then becomes a disorder. Right? We have another question. I think it's really important to answer this because I think a lot of parents or teachers and caregivers experience the situation. What can be done if the child is suddenly having anxiety attacks? Even as
Mhm.
adults, no, during the pandemic,
Yes.
nakaranas ako ng anxiety attack. What's
Yeah.
helpful?
What can be helpful is, first of all, we have to make sure that we are also not panicking when we see someone panicking. Kasi, so that we can regulate with the child. And so keep our calm when we see someone panicking. And then see if we can engage the the child in doing some of the relaxation techniques that I mentioned earlier. Diaphragmatic breathing, or what we call belly breathing, is very helpful in calming down the nervous system, uh, the nervous system, and therefore when the body calms down, the body will send signals to the brain that everything is safe right this moment. So that's one. Continue talking to the child. Being your calming presence can in itself be very helpful to the child who is having anxiety attacks.
Yeah, on my end naman, parang ano yun, I think Malin discussed like some strategies, but there's also this what we call tip skills, TIPP. That's something that you can also search online. Very simple. It's from another framework of psychotherapy called DBT. So tip is T, temperature, change the temperature. No, sometimes when I also have that attack, hold ice. No, either very cold, or I also dip myself in cold bath. Or take a warm shower. I is intense exercise, no? So you can do something pero kung kaya sabayan niyo yung bata at I know maybe na no parang it's challenging yung parang kumbaga dinidistract mo yung senses mo, no? So intense exercise, you can do planks, sit-ups until the anxiety goes away. P is spaced breathing, which is something that's already discussed. And then another P is progressive muscle relaxation. So tensing, di ba na pag-usapan natin na related yung body, no, sa nafe-feel natin anxiety. So sometimes we don't notice na we're already tense, but when we do progressive muscle relaxation, we can intentionally relax those things. And that's for intervention. But for me, what's more important is the prevention, right? Yes, there are times na parang kailangan talaga it would build up, no? Parang we won't notice, but developing yung sense of checking in with yourself and your child and being more attuned. Meaning, aralin natin yung signs sa anak natin or in the child kung ano yung parang ano yung start na parang medyo na anxious na siya. And like what we mentioned, 'di ba? Kahit hindi pa sila nagsasabi, no, parang low na yung mood, or for example, I have a nephew, no, na siya, energetic talaga siya. So but when I see him and parang hindi pa naman siya anxious, but I see na parang nagsa-slow down yung speech niya. No, so that's when we start doing breathing exercises. No, so you do that throughout the day. I describe it as like a cup. No, anxiety could be like, hindi siya nakikita. You pour like water, no? Imagine that water or liquid is anxiety. And then throughout the day, sometimes you don't notice it, but your cup is getting filled already. No, yung mga strategies that was taught, it's a way of emptying that cup throughout the day. No, so parang kahit may ganitong level of water, right? If you do the exercises, then you pour that out, and then you have more space for those things that make you feel anxious.
Thank you so much. Ang dami nating tips about how to manage an anxiety attack, not just for kids, but for ourselves. So be a calming presence, regulate the body to regulate the mind, at saka prevent it by being very attuned to the cues of the child. No? So hindi siya aabot sa anxiety attack. Thank you. Ang dami nating questions. We have a very engaged and interested audience in this session. I wanted to pick up this question that's, I think, coming from a teacher. And we have several teachers here, no? In a school setting, how can we explain to parents that their child has anxiety? How do we help parents understand or become more open to addressing their child's anxiety? Because sometimes, I guess the experience of teachers is when they talk about it with parents, the parents tend to be defensive. So, kayo, Cherry and Malin, when you work with parents, how do you talk to them about their child's anxiety?
Yeah, hindi lang kayo ma'am yung may challenge niyan, kami ding mga psychologists.
Yeah.
Well, first I make sure na we are on the same page sa parents. Pag sinabing anxiety, tatanungin ko ano ba yung definition niyo ng anxiety? Parang ano yung iko-consider niyo na parang hindi na normal, ganon. And then, I do a bit of psychoeducation. Like, the information na minention namin sa inyo na, o sige, ganito yung anxiety niya, pwedeng hindi pa ganon ka debilitating. Pero 'di ba na-mention natin, pero may implications 'yan in the future. Ito yung mangyayari. So may konting pananakot tayo. No, hindi, we're not doing it, 'di ba? For for just for kicks, but these are based on studies, right? So parang it's more of that. First clarifying kasi minsan iba yung definition ng parents ng anxiety eh. Feeling nila yun yung tipong for some they consider anxiety as very extreme na or depression, like they would they would associate already with, for example, suicidal attempts. Parang yun yung definition nila. Right? So we have to be parang kind of clarify, right? Na ano ba yung meaning ng anxiety and what are the things that you're observing, no? And sometimes kasi parents can be very defensive kasi understandable. I've encountered parents na they would feel like they are failures as parents if their children are experiencing this. So providing them support and making them feel that we're not judging them. Right? We're not judging them na parang it's normal na parang it's understandable na may anxiety, and some parents would back down pagka ganun na parang it's not your fault, there are things that we can do. So ganun din, it's more of also psycho-educating them, understanding the outcomes, and then third is to make them feel reassured also, parang turn them into our allies na magkakampi tayo. No, we both want the best for our child. This is not in any way, me communicating this is not in any way parang a way judging you. And eto, 'di ba I gave you like links to forms. So you can have the child fill that up. So you have more concrete evidence also na parang this is not just observation, but there's data that's supporting my observation.
Yeah, for us psychologists kasi, when we see the child, we can administer the assessment forms and therefore may proof to the parents na ito yung results. But I can understand for teachers, it can be a difficult discussion with the parents. So to add lang to what Cherry said, highlighting also yung benefit of the child pag nag-undergo ng intervention, can learn skills, that can help the child manage emotions, not just anxiety, but other emotions as well. And that can, lead to, building the resilience of the child and, building the child's emotional competence. So, para mas positive yung discussion. Kasi kung minsan nga, pag sinabi, may anxiety disorder yata yung anak nyo. So, syempre, I think parents can't help but be defensive, or they might feel scared also na, something's wrong with my child. So, turning the conversation into something positive, something can be done here, and that can help that child. So, that could help, ease away their anxiety too.
Yeah. So positive and negative tayo, Malin, no? But overall, I would tell the parents, wala namang mawawala.
Mawawala. Correct. Oo.
Parang, you have more benefits than there's more pros than cons if the child learns, if we address these feelings.
Okay, so don't judge parents, or don't make them feel judged, at saka give helpful information to understand it better, no? And all the things that they learned in the session today will be helpful in providing psychoeducation to parents. Siguro, sobrang dami talaga ng questions. But we will have the last two questions. I'll maybe address one question to Cherry and one last question to Malin. Cherry, my question for you is, how long do anxiety disorders in children last? No, so siguro for parents who might get anxious about the anxiety disorder, how long does it last?
Mental health problems are considered chronic. No? Yung debilitating, it depends, it varies, right? Kasi iba-iba naman yung background natin. Pero ideally, in terms of, so I'm coming from a neuroscience perspective, in terms of reorganizing the brain, a child can have, or even adults, no, magbabago yung the way we react or the way we learn skills after 3 months of regular intervention. Right? But again, anxiety, mental health problems are usually chronic. So if you've had one experience of it, an episode, you are more at risk to experience it in the future. But that is why it has to be addressed the first moment it happens, no? Kasi when you learn the skills, then you don't need to do intervention, no? You can, parang alam mo na what to do. But ideally it's 3 months. For more clinical manifestations, yung advice ng psychiatrist is without medication, usually it takes at least 8 months. No? But with medication, the treatment, parang the outcomes can come up sooner than later. So, yeah.
So Cherry, we don't have to necessarily see medications as a bad thing, no? It's something, because it's a neurobiological disorder. Sometimes it's really a necessary part of the intervention.
Yeah, but not for everyone. No, we're
Yes.
not saying na pag may anxiety, bigyan agad natin ng medication. It's not. Of course, you still have to take the advice of the doctor or the professional you're seeing.
Thank you. Malin, I'll ask the last question, kahit na madami pa tayong questions. In the Filipino context, I think this is very important, yung spirituality or religion, di ba? Kasi parents want to, to share their spirituality or religious beliefs, their faith experience with their kids. In what ways can that hinder or help with anxiety? Are there ways that spirituality can help or hinder when it comes to anxiety disorders?
Yeah, spirituality can be helpful if we turn it again into something positive. Like, sometimes kasi if the spirituality, yung pananakot in a sense, can add to worries and anxiety of children, not just children, but even adults, diba? So if we actually highlight what's positive about the religion, about the spirituality, that can be helpful. Para siyang yung kung i-link ko again to neuroscience, parang one of the ways to manage the cortex, in a sense, parang yung mindfulness, di ba? I mentioned kanina, mindfulness can be helpful because it helps bring your attention away from your worries back to the present moment. In a sense, spirituality is something like that. When you focus on something that's positive. For instance, the sense that I will be safe if I have faith. I'm not alone because I have faith. I have faith that God will be here to protect me. That can actually be helpful. That's one way of turning spirituality into something helpful. So yeah, I don't know if I answered the question of whoever asked the question, but yeah, focusing on what's positive about the
Thank
spiritual.
you. Thank you. I think Sherry wanted to add some thoughts to respond to that question.
Yeah, so there have been studies, no, one in 2019, 5,000 participants, adolescents, and also another study that reviewed 17 studies on the effect of religion, no, on mental health. And overall, the results are it's positive, right? But bakit siya positive, no? It's not just as Malin mentioned, sometimes you have different interpretations of religion and how to practice it. But why is it positive? Because there are three things that religion does for us. So first, it helps us with coping mechanism, 'di ba? Prayer is a sort of is a kind of meditation, no? Having that faith that everything will be all right is a coping mechanism. Second is it gives us some sort of anchor, no, in terms of morality. What are the things that are helpful? What are the things that we shouldn't do? Kasi actually, in terms of the Bible, may mga practical may mga practical na suggestions, but parang in terms of this manuscript, may mga practical doon na tinuturo, no? Kaya some of them are not applicable to us because iba yung context ni Jesus Christ with us, no? And then third, it gives you gives you a sense of meaning. And fourth, it gives you a sense of community. So that's what religion can do for us. But as Madin mentioned, if these four things are no longer highlighted, no, it's not going to be helpful. If yung internalization ng morality naging punitive na, it's not parang hindi na focus yung relationship mo to the higher power, then or love, no, it's not on love, but it becomes like punitive, becomes like you should do this, you should do that, then that would create yung negative effect. So for some naman who are not necessarily religious or spiritual, it doesn't mean na you can't achieve these four things. There are other things na you can also achieve yung coping, meaning, internalization of morality, and then community. You can also achieve that in other ways. So yes, religion can be helpful, but we have to be mindful on how we are practicing it.
Thank you so much. A lot of people are appreciating your responses, Cherry and Malin. They're saying it's amazing. It's amazing. So religion or spirituality as a source of safety, connection, meaning, community, values are very helpful aspects of spiritual or religious experience. Maraming salamat. We're just going to extend for just a few minutes so we can synthesize this session and end with a safe space visualization that we're sharing with everyone here. So I hope you permit us to extend for about 5 minutes, and we thank you very much for staying. And we really appreciate that you're finding this very helpful and informative. We're getting a lot of encouraging feedback. Thank you po. So thank you, Malin and Cherry. Just to synthesize some of the things that you've covered today in your discussions, anxiety is a mind-body experience. No? We regulate the mind by regulating the body and vice versa. Anxiety is not a bad thing. It's a normal response to stress, threat, or danger. Pero when anxiety becomes a constant reality, when kids are constantly overwhelmed or they're not equipped to manage it, it constricts their development and their functioning. Sherry has emphasized being curious about changes in the behavior of children and teens. Let's be curious, compassionately curious, so that we know how to support them. Safety and connection are essential also to addressing anxiety. This is the basic need of the human nervous system, is to feel safe and connected. And Malin emphasized the importance of interventions that work to rewire the brain. These interventions can be formal, it can be done by professionals, such as teaching kids coping skills, doing exposure training so they learn to manage or face their fears, But a lot of these interventions that rewire the brain are everyday things that we can do to help kids manage anxiety and stress. So, sleep, consistent sleep, exercise, teaching them to meditate, being a calming presence in their lives, being validating of their emotions and their experiences are all very powerful experiences that can rewire the anxious brain. So, working with the family system is really also very crucial to addressing anxiety disorders. So, we hope that you have learned a lot in our session today. And we are ending this session with a safe space visualization to help us all connect with our safety, our sense of calm within us. So I'd like to invite everyone, all of us gathered here, to adopt siguro a grounded position. Let's take a few breaths together, breathing in and breathing out. Our breath is regulating our nervous system. Let's take a moment to connect with the breath, breathing in again and breathing out, relaxing our shoulders, relaxing our belly, relaxing our chest. As we settle in our bodies, allow your mind to create a safe image. You can return to a safe space, a place you've been to before, or a place that you're creating in your mind, a place that makes you feel safe. There is no right or wrong. Without judgment, just allow the images of a safe place to flow in your mind. And notice that place taking shape for you. It can be outdoors, it can be indoors. There can be water, there can be trees, or it can be a room that makes you feel safe. Notice the feeling of safety in your body. Where is that feeling? As you notice the feeling of safety in this safe space, are you feeling it in your chest, in your abdomen, on your shoulders, your feet, your legs? And allow that feeling of safety to expand. Your safe place is always there for you. It is a place where you are held and supported. All of us have a safe space inside of us. Allow your safe space to become vivid. Notice what you can see. Notice what you can smell. Notice the sensations. Like if it's warm, or maybe you're embracing a warm blanket. Immerse yourself in this safe world that's inside of you. And as we take this safe space in, let's pay attention to our breath again. Breathing in and out. Let's carry the safe space within us. And slowly, we can return to the room while also remembering the safe space is always there for us. Thank you so much. Maraming salamat sa inyong lahat. Lawakan ang ating pakiramdam, lawakan ang ating pag-iisip. Muli, ako po si Dr. Joanna Jabi Herrera. Ako, tayo, para sa bata.